Welcome back to the Woven Well podcast. We have a lot of resources about birth control alternatives, natural birth control options, and fertility awareness methods. But a big concern for women who are considering alternatives is how to go about actually stopping birth control. Can you just stop taking it? Are there risks to stopping? Do you need to speak with your doctor before you just stop taking your pill? What can you actually do to support your cycle health as you recover from birth control use? Well, to help us talk through these questions, I've invited Dr. Monica to be on our show. Dr. Monica is NaPro Technology trained, FEMM trained, NeoFertility trained. So she is a restorative reproductive physician, and she cares very deeply about women's health and making sure to empower you on your own fertility journey. So I'm really excited to have her. Dr. Monica, welcome to the show.
Thanks so much for having me. I'm excited to chat with you today.
I think the first question that a lot of women want to know is, can you just stop taking your birth control pill? Is that okay? Is there some rule? Should you stop at a certain time? So maybe let's start there.
Yeah. So typically when we talk through when should we stop birth control pill, we typically recommend that you stop taking it when you start your menstrual bleed. So for many people, they know that as their sugar pill or the placebo pill. So that's typically the best time because there's not active hormone that's getting to you in your pill at that time. So if you're going to stop it, that would be the time. Now, with that being said, we always do recommend that you consult with a healthcare professional when you do this because many women start on the pill because they've had underlying symptoms that were not well managed elsewhere. And so we want to be able to have a good plan in place for what do we do if those symptoms return, right? So if I had heavy bleeding or irregular cycles or really painful periods, I want to be able to have that alternative in place before I would just stop at cold turkey. But with that being said, yes, you theoretically can just stop it. You could just stop it at any point in time, but typically we see less troubles if you stop it during that placebo week or when you're on your cycle.
That is so helpful to know. Now, you just mentioned a bunch of underlying symptoms that a woman could be experiencing, which is why she got on birth control in the first place. There are a lot of doctors out there who would say, hey, if you're experiencing those things, then stay on the pill until you're ready to try to conceive. Why is your approach a little bit different?
Yeah, so part of our main tenet in restorative reproductive medicine is really finding that underlying cause for what's going on with your symptoms and treating that cause. We don't want to just create this band-aid approach where we put you on a pill that just suppresses your symptoms. And part of the reason for that is that we want to avoid any harmful side effects. But the other is for women who are trying to preserve their fertility, we know that sometimes we have troubles with getting your cycles back again after you stop birth control. And so in order to try and help keep things as natural as possible, we want to help avoid those excess hormone exposures wherever possible. The other is that we utilize those symptoms as a sign that your body is raising a red flag and saying, hey, there's something wrong, right? We want to be able to identify those symptoms and treat the underlying causes of them because it's not always just about your fertility. There are many conditions that can actually show up that play a bigger role in your health, whether that's your metabolism, your sleep, your weight, your mood, and all of those things put together can help us to identify, hey, there's something else going on here that we need to figure out and really solve that problem rather than just covering it up and masking it with hormonal contraceptives.
Yes, absolutely. So, if someone is interested to understand those things that you were just talking about and kind of get rid of the birth control so that they can figure out why they're having the irregular cycles or painful periods or whatever it may be, how do they create a game plan before stopping? Because, like you mentioned earlier, it's good to have a plan in place so we know when to stop, but what else should we consider as we make that plan?
Yeah. So one of our first steps always is we want to get our patients plugged in with a charting instructor. So somebody like yourself or others who teach a fertility awareness based method, because that really then gives them the tools to utilize in order to have that conversation with their healthcare professional they're working with to say, here's what's going on with my cycle. Here's what I'm seeing. And it helps us to really all kind of be speaking the same language, if you will, to understand what am I seeing? How is this changing? How is it shifting as I transition off of birth control? So always charting instruction is a part of that. In my practice, we typically will also check some labs even before you come off of birth control to identify what are the underlying hormonal deficiencies that we may be seeing Or are there other underlying vitamin deficiencies or other nutritional pieces that need to be corrected? Because a lot of those things, we can start to repair and restore a lot of those things even before we stop birth control. Now, there's a lot of other hormone levels that are going to be out of range or abnormal because you're still on birth control. And so some of those we can't test everything until you're off of the pill, but really working together to say, how can we restore and repair whatever damage was done by being on birth control, whether that's vitamin deficiencies or hormone imbalances or other causes, and then really work through, okay, what does this stepwise plan look like? What is our plan if you have a return of very painful periods? Or what if you're bleeding every single day? What does that look like? And how can we get ahead of that so we have a really clear treatment plan in place? And then understanding what is the long-term plan for this, right? So there's kind of, we break it up into different phases as far as I just stopped the birth control pill within the last couple of months. That's going to look very different than, okay, now I've been off of it for 5 or 6 months. What should I be expecting to see? And managing those expectations and realizing that no story is the same. Every woman's journey coming off of birth control looks a little bit different, but really being able to optimize and walk through each step of that in a unique way that honors what's going on with her body in order to be able to make those improvements as we go.
I so appreciate the fact that you brought up a plan in place for potentially the return of painful periods, because I think about these women out there who have just been on the pill for years, sometimes decades, and the reason they're hesitant to come off, or maybe they want to try to conceive but they're really fearful about some of those symptoms coming back because it may be something like severe menstrual cramps. And so knowing that there's a way to actually have a plan in place to address that and hopefully heal and restore that is significant. And it all comes down to who you're working with as a patient. So your medical professional matters greatly. You want to make sure that you have someone that, first of all, is going to tailor it to you, like you were just talking about. Honor the individual woman and the fact that everyone's story is different, everyone's body is different. And so we need to make sure that it's a way that honors that, acknowledges that, and supports that. But also someone, even like you were talking about, that knows which hormones you can test on birth control versus being off of birth control, because I can imagine a scenario. It is not very difficult for me to imagine a woman having lab work done and getting these wild results, and maybe even the medical professional not thinking about that it could be because of birth control, or so it's just so important to be knowledgeable about that and have a medical resource that you can trust to be knowledgeable but also to be supportive and honoring of you as a person. So I really appreciate you mentioning those things in the game plan, because a lot of times we think about just our end as the patient. How do I stop birth control? But maybe the more complicated part of it is the medical side and partnering with someone that you can really respect and work with. And so I appreciate you mentioning that. So we can come off of birth control. There is an ideal time. It's at the end of the pill package. We want to have a game plan in place, but still we may have some surprising experiences coming off of birth control. So maybe let's talk through what we can expect as we stop taking birth control, whether that's physical, mental, emotional. What are some of the common things that we can experience?
Yeah. So generally that we say the most common things that people have is a return of whatever their pre-existing symptoms were, right? So if I started birth control when I was a teenager because I had heavy, painful periods, and I stop it 5 years later and I'm in my early 20s, oftentimes that's going to be the thing that we see comes back again because it wasn't fixed in the first place, right? We just covered it up, suppressed it, masked it for so many years.
Yeah.
And so oftentimes that can happen. However, it's not always the case. Sometimes we see that we come off of birth control and nothing is a problem, right? Like sometimes everything seems to be just fine and it can be a few cycles before things come back again. And so it's obviously really variable, but typically I would say from a physical standpoint, the most common things that I see in my practice are that estrogen, testosterone, progesterone levels are just super duper low because your body has been basically suppressed. It's not wanting to create these hormones. And in many of those cases, we see that periods just stop happening altogether. You have this, that we call it secondary amenorrhea, meaning you just don't have a period. And that can be a really common thing that we see. The other thing that we can sometimes see is the opposite end of that spectrum, where maybe the bleeding is just happening continuously. And so when we talk about a game plan with my patients, we always are talking about plan A, B, C, D. Sometimes we get all the way to Q before we decide, hey, we have enough things in place, because it can be a really scary time. And I would say emotionally, that's probably the number one thing we see across the board, is just fear or anxiety of, what if my symptoms come back, right? Or in some cases, women know that they want to come off of birth control, but maybe they're fearful. Maybe they're trying to avoid pregnancy at this time, and they're afraid of, what happens if I get pregnant? That's not what my intention is, but I really want to come off this birth control because it's given me some nasty side effects. And so a lot of that is talking through those fear points and saying, okay, if this happens, this is what we're going to do. If this happens, this is what we're going to do. And being able to really have multiple plans of action in place, but also to be able to address and normalize those fears and say, yeah, I get it. This can be really scary. If you're, for example, trying to avoid pregnancy, let's talk about what are the different things that we can talk through with your charting instruction that are going to kind of shore that up for you, right? You know, whether that means that we're using multiple different systems to check, or maybe we're using different biomarkers in order to evaluate our fertility. What does that look like for you, and how can we work through that? Or maybe it means, you know what, we're going to have you avoid intercourse for a cycle or two until we can see what your baseline is. But oftentimes it's just getting to those fears, addressing them, and then helping people to say, okay, and here's how we're going to walk through this together. But it really can be a variable process. For some women, cycles get back to their baseline within a month. And for some, we can be working together for a year or more before we finally are seeing some normalcy of cycles. So it's really variable. But again, that's why it's so important to work with somebody who's comfortable with walking through this process, making the adjustments that need to be made, and sometimes making those adjustments in real time and fairly quickly, rather than, okay, cool, I'll see you in 6 months, hope it works out for you, right? So keeping
Yeah.
in close contact with that person is so important.
I'm glad that you mentioned too the role of the fertility awareness based method instructor, because I do see that fear come up a lot. And that's our role. I'm speaking as a certified fertility care practitioner, but that's my role, is to make sure that that couple can understand when they're fertile, when they're infertile. And like you mentioned, when they're coming off of birth control, we don't know what we're going to see. And I try to prepare every client couple for that. You could have a period, you may not have a period, it could be bleeding all the time, but you could still successfully use this system. Now, of course, I specifically teach the Creighton model system, and we do at our organization, but you can still use this effectively and confidently, because we do a day by day real time use of the system. And so
Mhm.
really making sure that they have that education and they feel really empowered with that, they feel really confident about that, can make a big difference too on the emotional side of things. Whereas we have no say in the medical side. That is absolutely your side of things, and I'm so glad for it. You are the expert there. And so it matters a lot to us to be able to say, we don't know what we're going to see on your chart because we can't anticipate that, but we can
Mhm.
make sure that you're partnered with a medical professional who is knowledgeable in it and is going to work with you and create that game plan and be ready to respond quickly, as you were talking about. Now,
Yeah.
you mentioned the fact that you could maybe have bleeding all the time, or maybe have secondary amenorrhea when you're not actually having a period at all. Is it okay to just sort of wait if you aren't having a period and see if it comes back? Or is there a point that you probably should go in and start getting things going if it hasn't naturally?
Yeah. So, kind of the general game plan, whether you're coming off of birth control or whether you've never been on birth control, we say if your cycles are more than 45 to 60 days apart over time, that's not normal. There's something going on that indicates that. Now, most women will say, well, I don't mind not having a period, which seems okay in the short term, but typically there's some underlying hormone imbalance that's going on that's adding to that. And whether that's that you're not ovulating, or whether that's an imbalance of the hormone levels themselves, it is best to get that checked out, because there are other long-term health implications that play a role with that, specifically when we're talking about estrogen, progesterone, and testosterone. And when those levels are abnormal or are not well balanced, that's when we create longer term problems as far as mental health concerns, weight gain, osteoporosis or thinning of the bones. There's other implications that play a role with that. So generally, I say if you've gone more than 2 or 3 months between cycles pretty consistently, that's always a good time to get it checked out. And coming off birth control is no different. If you've gone 2 or 3 months and a cycle did not come back, good time to get it checked out at that point in time.
I love that you're thinking about the whole person health, the health, not just right now, but in 10 years, 20 years, 30 years, because
Yes.
that's what we're interested in. This person, this human being sitting across from us. And it's not just in this moment, but we're thinking about their
Mhm.
lifetime health and any way that we can be a part of improving that. So when we think about coming off of birth control, are there any other general ways that you think of to support the healing process as you stop birth control?
Yeah. So one of the biggest things that we know, and this is actually documented well, even in conventional medical literature, is that the birth control pill especially does a number on depleting us of many of our key nutrients. So almost all of our patients, as they're coming off of hormonal birth control, the oral pill, we end up putting them on a B complex vitamin for at least 2 to 3 months, just because it is so depleted in many, many women. And so really focusing on that nutrient balance, but also just on general good lifestyle habits is that, getting enough sleep, managing stress where we can, getting regular exercise, because we know that all of those things help to restore hormonal health. And, we say it's might be easy to say that. It's sometimes harder to do all of those things, but anywhere that we can help to support things from a lifestyle standpoint, that can make a huge difference on healing. It's going forward.
Mm. Thank you so much for being on the show, for sharing your knowledge and experience, and really encouraging the women out there who are considering coming off of the pill, trying to maybe sometimes gather up the courage to do it, but having this medical support in the process is a game changer. So thanks so much for being on.
Thank you for having me.
Listeners, there are alternatives out there. Just because you've been on birth control doesn't mean that you're stuck on birth control. There are safe ways to transition away from it and address the concerns that got you on it in the first place. So, we would love to help you along in that process. We teach the Creighton method, and we would love to invite you to join an introductory session to learn more about it. It empowers you to avoid pregnancy naturally if that's what you're interested in, and get to those underlying causes of women's health issues that you may experience. We have a virtual introductory session each month, and we'll make sure to link it in the show notes for you. As always, thanks for listening as we continue to explore together what it means to be woven well.